So after the benign neoplasm, let's talk about some malignant neoplasm of the salivary glands. And the malignant neoplasm which we will discuss in this section are the mucoepidermoid carcinoma, malignant mixed tumor, lymphoma, sarcoma, and also Fraze syndrome. So first, the mucoepidermoid carcinoma. This is the picture of mucoepidermoid carcinoma. It's a slow growing and it invades the facial nerve. Facial nerve is a cranial nerve that widely innervate the facial muscles of facial, all that. And then when that is invaded by the tumor, we have different complications that can occur as a result of involvement of the facial nerve by the carcinoma or the tumor. So it's a slow growing, not rapid growing, and it invades the facial nerve. It mucin producing and squamous cell. Low grade usually is associated with good prognosis and it's common in children, which is low grade malignancy. As we talked about this in our previous lectures also, grading of the tumor and differentiation of the cells of the tumor on biopsy is very important prognostic factor. If it's low grade and the cells are well differentiated, prognosis is better as compared to the cells which are high grade and then they are poorly differentiated. Those cells, those tumors have poor prognosis. This has good prognosis. It's more common in children. High grade, aggressive and poor prognosis. More epidermoid element, more malignancy. So now we notice this is the mucoepidermoid carcinoma. If the epidermoid element of the carcinoma is more, then it's more malignant. There is more tendency to spread more and invade more because of the more epidermoid element. Other malignant tumors, we have adenoid cystic carcinoma, also known as cylindroma. It's a slow growing carcinoma, adenoid cystic. Invades perineural space and lymphatics. Pain and the seventh nerve palsies, which is the facial nerve. There is facial nerve palsies associated with it. Treatment is radical parotidectomy or post-operative radiation. So parotidectomy is done in which the parotid gland is removed and after the surgery, radiations are given to prevent the recurrence or spread. And then the other type of malignant tumor is the actinic cell carcinoma. It's low-grade tumor. And the tumor is small, firm, movable, and encapsulated. Sometimes bilateral, superficial, or total parotidectomy is performed for the treatment. Third type of malignant carcinoma here is the adenocarcinoma. And then we have, it's mainly involved the minor salivary gland, not the major salivary gland, which are the parotid, submandibular, and sublingual. It's highly aggressive locally. And there are about 100 to 1,000 minor salivary glands. So involvement of that occurs and is highly aggressive locally. And its distant metastasis is common with this type of cancer, which is adenocarcinoma. So all these are different types of malignant carcinoma. We have actinic cells and then adenoid cystic carcinoma and adenocarcinoma. Malignant mixed tumors, the malignant mixed tumors, we have two varieties, carcinoma in pre-existing benign mixed tumors, and then we have a de novo tumor. So it can occur, malignant mixed type of tumor can occur in the benign mixed type of tumor, which is superimposed cell differentiations occur and become the malignant tumor. Rapid growth and pain in benign tumor occurs. Treatment is radical parotidectomy and grafting of facial nerve. You can see it's a huge big tumor growth, and the mixed type usually can occur in the already existing benign mixed tumor, which becomes the malignant and de novo tumor. The rapid growth and pain in benign tumor, and the treatment is radical parotidectomy. And since facial nerve is involved and that can cause different complications, the grafting of facial nerve is also performed. Squamous cell carcinoma is rapidly growing type of carcinoma. It infiltrates, causes pain and ulceration in the skin, metastasize to the neck lymph node, to the cervical lymph nodes. From the salivary gland, it involves the cervical lymph nodes. Treatment is radical parotidectomy. May include cuff of muscle, may include portion of mandible, and there is also involvement of temporal bone and skin. So in radical parotidectomy, different local surrounding structures are also treated or removed, including the portion of the mandible and may include the cuff of the muscle. Here, this is the squamous cell carcinoma of the parotid gland present here. And then post-operative radiation is also performed after the surgery. Undifferentiated carcinoma, rare, but it's aggressive. Undifferentiated carcinomas are always the high-grade aggressive type of carcinomas. It's fixed to skin and ulcerates, it's painful. Cause facial paralysis and cervical node metastasis. Treatment is wide excision and radical neck. Post-operative radiation is performed. So wide excision, and then it is spread to and metastasized to cervical lymph node. So radical neck dissection can also be performed. Lymphomas and the sarcomas. Lymphoma is rare tumor associated with the systemic disease, can be a primary tumor. So it's rare, can be primary lymphomas, but mostly it is associated with systemic disease. Treatment same as for other lymphomas. Sarcomas, rhabdomyosarcoma, rare arousal from the parotid gland. Then we have the Frey syndrome or gustatory sweating. In this, it occurs as a complication of parotid gland surgery. Sweating and flushing of preauricular skin. So after the surgery, this complication occur known as gustatory sweating, and there is very bad sweating and flushing of preauricular skin, and that is sometimes a social embarrassment also, people who have this problem. There is aberrant innervation of the sweat glands, tympanic neurectomy, a sheet of fascia lata between skin and underlying fat, and there is subcutaneous infiltration of the botulinum toxin. So all these are the different causes of the gustatory sweating because of aberrant innervation as a result of the surgery performed on the parotid gland. Tympanic neurectomy, sheet of fascia lata is present between the skin and underlying fat, subcutaneous infiltration of the botulinum toxin. So this was all about section 5, and this is all about our lecture topic 2, in which we discussed in detail all the different disorders that can involve the salivary gland, which can be major salivary gland and the minor salivary gland. Thank you for watching sqadia.com.